from the station that's on your side. This is Channel 7 News Daybreak.
6:23 is the time. Recently, The Biggest Loser host Bob Harper suffered a heart attack, and he is, as you know, a healthy, fit person. So we wanted to ask our Baptist Health cardiologist, Dr. Scott Davis, if there's more to healthy hearts than just being fit out there. Dr. Davis, good to see you as always. This is something I think took a lot of people by surprise because you say, wait, this guy? The guy who is in shape, getting other people in shape, the kind of the model for a fit person, and he has a heart attack.
It's the Jim Fixx phenomenon. Remember the marathon runner back in the 70s who was the big advocate? And then he fell over dead in a ditch from a heart attack. And so the thing that I tell people is that, look, first, the stereotype isn't always fit everybody, and that is the paunchy, middle-aged, two-pack-a-day smoker whose only exercise is, the 12-ounce curl from getting a beer out of the refrigerator. And so, the thing I emphasize to patients is, number one, is that coronary disease, heart disease, does not discriminate, okay? And number two is you can't out-exercise your genetics. And so for somebody like this gentleman, I don't know his history and I don't know his genetics, but the thing is that it's important to understand what's my cholesterol, what are my risk factors. The example I always use is my own father. My dad was a marathon runner. He was a marathon fiend, ran 30 marathons in his lifetime, and had bypass surgery at 62. And so, his exercise didn't address his high cholesterol, right? So I've had 20-year-old, 30-year-old super fit patients who have cholesterols over 300. Well, that exercise is not going to bring that cholesterol down without some type of medication. So the thing is that don't allow being fit to lull us into this false sense of security.
And only 51 years old, too.
Right.
That's another thing that people say, that age and that kind of healthy living or lifestyle, even more surprising, right?
And again, well, it can be. It can be surprising and it's shocking, certainly. But again, it's this false sense of security that exercise can then be the complete, panacea to forgive every sin. And it does not do that. And so, what we don't want to do is to say, well, Dad had a heart attack at 48 or 55, but, he smoked a lot and he was overweight, and so I'm going to exercise, and that means I'm completely off the hook. So pay attention to your family history. Go ahead and get your cholesterol checked. There's more and more information coming out that shows benefit of lowering your cholesterol with medication than ever before. And so, I understand that, I've read a lot of bad things about the cholesterol doc.
Or you hear the commercials and all the side effects, and you're like, well, I don't want to go through any of that.
But so be real careful with the internet, right? That's a two-edged sword. So the Googles, be real careful with that.
WebMDs?
Yeah, that's right. Well, stick towards WebMDs instead of, Mike's blog.
Right? Yes, sure.
But, pay attention and engage your doctor. Don't just think that you've got this false sense of, well, I exercise, so therefore I don't have to have my cholesterol checked or have my risk factors checked.
All right. You get those risk factors checked at Baptist Health, and always see your primary care physician, too, to get that appointment set up with a Baptist Health cardiologist. There's a number on your screen, and Dr. Davis will see you next time. Thanks for coming in, bud.
Have a great week.